Hello, welcome everyone. Thank you for joining us. I'm Maggie Jacqua. I'm the content director of Whole Foods Magazine. And today I am honored to be partnering with Nutrasource for the NutraViews educational series. Our talk today is going to be the first in a 4-part series. We're going to be covering topics that can help you best reach and serve your female audience. And throughout 2022, we're going to be covering topics that impact every aspect of the natural products industry and our ability to best meet the needs of our female customers. That's going to include shortcomings in research, we'll talk about today, to shortcomings in messaging and marketing approaches, and much more. Throughout this talk, something that I think is unique and interesting is we're going to be hearing from both industry experts and consumers, the shoppers that you really want to reach. And that's going to help give you a really full and thoughtful view that will help you get a better understanding of some of the problems, as well as the solutions and the opportunities that can help you better serve your customers. The team at Whole Foods Magazine will be updating you on future talks. As I said, there'll be 4 in this series. So stay tuned for details. We'll be bringing those to you on WholeFoodsMagazine.com. Now today, our focus is on science, and we're going to discuss the lack of female representation in research. We have speakers who are well-versed in this topic. We have Dr. Trisha VanDusseldorp. She's an associate professor of exercise science and exercise science program director at Kennesaw State University. And she also serves currently as the ISSN president. We also are joined by Dr. Susan Hewlings. She is the director of scientific affairs at Nutrasource GRAS Associates. She oversees scientific and nutrition projects for the dietary supplement, food, beverage, and companion animal nutrition industries to help companies substantiate their claims. So great perspectives we'll be hearing from her. We also have Karen Howard. She is the CEO and Executive Director of Organic and Natural Health Association. Karen has spent 30 years working with Congress and state legislatures, healthcare organizations to develop innovative healthcare policy and programs, and she does so much for our industry, so we're really happy to have her here joining us. And also William Rowe. He is the president, CEO, and co-founder of Nutrasource. He has over 20 years of industry experience and has been instrumental in designing and implementing strategic solutions and claims. And he has some great perspectives for us today as well. So I'd like to invite all our panelists to join me on our virtual stage now. Thank you all for being here. Welcome, welcome. So I want to start by asking each of you just to give us a bit of background that'll help give our viewers a sense of your expertise and your interest in this topic. So Trisha, I'll start with you. If you can just tell us kind of your background and you know, what you're kind of bringing to the table here.
Yeah, absolutely. My background is predominantly in academic research. So as Maggie highlighted, I'm a professor at Kennesaw State University, which is a teaching and research institute. And I'm also involved in industry with the International Society of Sports Nutrition. So definitely more of a research aspect and bring highlights of the lack of female data available to date in especially the nutrition and sports nutrition world.
Excellent, thank you. And Sue, I'll turn it over to you.
Hi, and thanks for having me. And as you highlighted, I'm Director of Scientific Affairs for Nutrasource GRAS Associates, and I help companies substantiate their claims. And so I help to bridge the gap between science and industry. And as part of that, I am also a professor at Central Michigan University in their graduate online nutrition program. I've been in academia for almost 20 years. So I like to connect the science and the industry. And that's the perspective I hope to bring today. So thank you so much for having me.
Excellent. Thank you, Sue. And Karen?
It's really wonderful to be here. I'm very excited about the conversation. I cut my teeth here in Washington, D.C. as a kid in politics, but in my journey to get to where I am today, I've spent a lot of time working with consumer-oriented issues, whether it was when I was with the naturopathic physicians, the National Animal Supplement Council, or now. So we've really spent a lot of our time engaging in what we can do to support consumer journeys through health.
Excellent. Thank you, Karen. And Will?
Yeah, thanks a lot, Maggie. Great to be here. William Rowe, President, CEO, and co-founder of Nutrasource, a company I helped start roughly 20 years ago. And so from a business and science perspective, I have an understanding of clinical trial design as it relates to substantiating claims, market positioning, and producing intellectual property for the global health products industry worldwide. over the last 20 years. So hope to bring some insights in that respect as relates to the topic.
Excellent, thank you. And as for me, I am the content director of Whole Foods Magazine. So I've been in the industry for years, but also I've worked in consumer women's magazines for about 2 decades. So really serving the female consumer, specifically in the health and nutrition and fitness areas. So I'm excited to be part of this conversation as well. All right, so I want to dive in. I'm going to give some data that just sets the stage overall. So this isn't exactly specific to our industry, but just to give a sense of what's going on out there. So science shows that women are underrepresented in research, both in terms of being enrolled in clinical trials and in terms of conducting the research and being on the publishing side of those studies. So I want to start with just an example that helps illustrate this problem and shows just how severe the consequences can be. So looking at the heart health category, research highlighted in February 2020 issue of Circulation included an analysis of data from clinicaltrials.gov, and it revealed that women represented just 38% of people enrolled in heart disease and stroke clinical research. And the review on the number of women who study and treat heart disease and stroke, and those being chosen to publish the research, also shows that the gender gap in academia is wide. And in the case of heart disease, which we know is a top killer of women, the American Heart Association suggests that this lack of knowledge specific to women could be a contributing factor in disparities in terms of symptom recognition, treatment times, and life-saving support. And there's another study out of the UK that found that women are less likely to survive a heart attack, particularly when treated by a male doctor. So these are just kind of eye-opening, analysis, very specific to heart disease. But turning to nutraceuticals, Sue, can you share your insights on research in terms of women in nutraceuticals? What does it look like in our industry?
Well, I think it mirrors what you're highlighting in medical research and in health research in general. And that especially health issues that are specific to women seem to be particularly underfunded. So I think you did a good job at laying out sort of the map or what we're talking about, and that everything's really interconnected. And it's even also interconnected, of course, to women studying in the sciences, et cetera. So it makes sense then that our industry would reflect the same statistics, and that there is a definite gap for women being studied in all areas, whether we're focusing on sports nutrition or in sleep areas, et cetera. There's a definite lack of women participants. And then to add to that, there is the general tendency to take what has been applied to men and just sort of say, well, women are just small men, and also to do that with the marketing. And there's been a lot of talks, and a lot of women in our industry have highlighted that and talked about how we just put it, put a bow on it, put a nice pink wrapper on it, even though we haven't studied it in women. And that then trickles into adverse events and on and on. So it's all interconnected.
Yeah, and we're going to dive deeper as we go on into our talk about some of those things you just talked about with the marketing and messaging as well. Trisha, can you give us a picture of how the gender gap looks in the sports nutrition area?
Yeah, I'd be glad to highlight that. The current state is really that we've done a really poor job of studying women. We know that we need to fix it. Despite thousands of studies published each year in the area of sports nutrition, females are significantly underrepresented. It looks to be, if you look at the recent reports, there's a 2022 paper that came out. It's excellent, looking at data comparisons of research in females versus males. And it's only about 20 to 25% of investigations actually include females as their subject population, just focused on females, and even looking at data that that have investigations of just one female participant in a sports nutrition study, it only goes up to about 30%. So it's really unfortunate, because females, like males, are actively engaged in sports and exercise. They have a great deal of interest in supplements that impact their performance and recovery and health, and we've, as Sue mentioned, historically pressed male evidence-based recommendations onto females. due to that lack of research. And there's a host of reasons why, including the complexity of female physiology itself, additional cost and time of studying females, especially speaking from an academic setting. It can be especially true and difficult and frustrating, but we know that we need to shore up that research and kind of push the envelope and get past those hurdles.
Yeah, I really want to dig a little deeper into that. And we're going to talk about both the business side and the health reasons for that. But can you give us kind of, Trisha, a deeper look into some of those complicating factors? You touched on some of there's fluctuations throughout the menstrual cycle, hormone levels, lipid levels. Can we get into some of that?
Yeah, absolutely. One of the biggest things that we often run into is you're designing a study and you want to control for as many variables as possible. So hormones tend to be the biggest factor for us when it comes to designing female-based research. And with that comes birth control and lots of different types of birth control, and understanding that throughout the menstrual cycle, that metabolism changes. So in one phase, we may have females who are metabolizing carbohydrate faster than others, or fats to that extent. And then the other aspect, if you look at supplement research, is that during a certain phase of a menstrual cycle or hormonal phase, that women may respond stronger to that given supplement. So these are all factors that we have to overcome and plan for. But it's just a matter of discussing that openly and stating that.
So talk to us about the impact that all this has on nutrient metabolism. You talked about claim substantiation, and we'll get deeper into that, but I want to have a better understanding of how all that is impacting nutrient metabolism. So the products that we're offering people.
Yeah, absolutely. Well, I think that, during different phases of the menstrual cycle, different macronutrients are utilized differently. So for example, the one example is that carbohydrates may be used more efficiently in the follicular phase. There's also some evidence to suggest that in the first half of the menstrual cycle, female athletes may be more vulnerable to ACL damage. And so there's lots of, that's sort of displaying just sort of an overall, it's not just specific to macronutrient metabolism, but there may be nuances that vary throughout. But I contend that really what drives the lack of research is a lack of understanding and education regarding that. Because we can certainly actually use that to our advantage, not to it's always viewed as a disadvantage in research, and it doesn't have to be. And one example I came across was a study put out by Dr. Brunevels in the British Journal of Sports Nutrition, and it's highlighting the work that she did with the U.S. Women's soccer team to help them to a successful season in 2019. And she actually uses the menstrual cycle for their training. So she has the athletes mapping symptoms along with their menstrual cycle and uses it to their advantage, and designs their training schedules to integrate with that, and has had great effectiveness and has documented it in research. So I contend that it's almost like an excuse. It's almost like an excuse that we all have to use education and awareness to offset in whether it be sports nutrition, dietary supplements, or science in general. So that's my 2 cents on that.
We got a comment that came in that I want to read, and also invite everybody, please join the conversation, put your questions into the Q&A box, and we'll pose those to the experts as well. But the comment that came in is in the pharma industry, it is still a concern that clinical trials are done together on men and women, though women are different from men, and some groups are insisting that products must be specific to women and men and not together. And she notes that this is applicable to the supplement industry. So I want to ask Will the next question here. So from a business standpoint, there are obviously complications, as we just alluded to there, in terms of planning and cost and risk. So from the business side of things, yes, I'm sure the desire is there to have more equitable research, but what factors are complicating it?
Yeah, it's a very good question, and it ties into the academic aspects of what's been discussed in a more business practical sense. This was brought to my attention 20 years ago when we were launching an omega-3 diagnostic around cardiovascular risk assessment, and we were pitching our diagnostic test, which was based around cutoffs associated with a specific paper. And we were pitching it to a female MD and asking her to incorporate it into her practice for cardiovascular care. And we sent her the paper in advance of the call, and we showed up to the call, and she indicated to me that, well, this is a great paper and a great test, but the paper you provided is exclusively male participants in the study in the paper. Do you have evidence as to what the similar cutoffs would be for females? And we were completely stumped, and I've been trying to find the answer to that ever since 20 years later. So in that respect, to the point earlier, in a more practical aspect, even sharing the data, interpreting results, there is this need, and there is this gap that exists. And further to that, over to the clinical side, when I was trying to better understand and answer this MD's questions and try to find a suitable paper with similar results, which didn't exist, in fact, when we looked at this issue of finding female data, in this particular instance, it was in the cardiovascular area in general, I asked around to lipid scientists and academics and some sponsors as to why the data didn't exist or wasn't developed to the same level of sophistication. And one of the main answers was due to menstruation and the complications that it has in practically running a study, how it costs more, it takes more time, you don't get your results as quicker because you have to control for the cycle, and when the participants show up to the clinic, there's a higher attrition rate with that population because you only have a small window every so often, obviously, to bring that participant in. If they miss that window, you have to wait another 30 days plus or minus to have them in again when things are stable for a control of variables perspective. That turns out that turns into a longer time frame, more cost, higher attrition rate. So a lot of the sponsors are simply about speed and getting things done as quickly as possible to file intellectual property, to substantiate their claims, to get to market as quickly as possible. So that's one of the reasons I think I can conclusively point to as to why this issue exists.
Yeah, so it's going to take a lot more commitment on the part of the companies to see it through with the research in the women.
Correct.
Yeah, I read, and this is kind of a strange aside, but I just read this weekend. It just came up in my feed, and I think it was from Discovery Magazine. But this has nothing to do with actual real women, but crash test dummies. They don't have crash test dummies for real size women. So even in something where you don't need a real woman, it's not menstruating, it's just a dummy. Even there, though, it's not happening. So I just found that very interesting. Yes, that's a little aside, but, and I also read some studies that seemed a little, some commentaries that seemed a little dismissive, saying that the problem was that women are not enrolling in the studies, like that it's an actual enrollment problem. And maybe that's part of it, but it seems like it's a far deeper issue than that. Yeah. So
yeah, we haven't seen that issue specifically, Maggie, in terms of enrollment. I think a lot of it has to do with how the trial is publicized and advertised to the population as well. That has a huge impact on the type of potential participant that shows up to the clinic to enroll in a study.
Yeah, that's a great point. So it's really coming from the beginning. So I want to talk about some of the deeper implications in our industry, for our industry. And when we talked prior to coming on this call, you told me that the lack of female representation in research leads to some significant disconnects in terms of our industry. And one disconnect, and Sue touched on this earlier, concerns claim substantiation. Can you talk us through the problems there?
Yes, and it ties back to what I was saying earlier as well on that diagnostic discussion is how does the data, how does the evidence support the target markets? Obviously, if there's a menopause study, by default, it's a female population, for an example. And those are easy. So from the standpoint of claims, though, how is male-dominated substantiated data used to validate claims across the board for both genders? I think that's an area that needs a lot of shoring up in our industry, absolutely. And to me, that's also the opportunity, and we're seeing that pivot and momentum already. We talked about problems, but from moment shifting to solutions, there's real opportunity there to do that deeper dive in the female population to see if the same findings occur, or perhaps better findings may occur. You might get a better response and have an even better marketing study and create more intellectual property that you can file against your branded ingredient or against your formula or to support your trademark. So there's a real opportunity there by shoring up this deficiency as well.
Excellent. Karen, I want to talk to you about another disconnect that was mentioned, and that deals with who the primary consumer is in our industry, which is women. Can you talk us through some of the issues there?
Yeah, it's very clear, and there's no mystery. And now, this is data that we've had for a long time. Women are the managers of healthcare in their households. They are in charge of the meals. They are in charge of the vitamins. They are in charge of the supplements. They carry generational knowledge in that role, and they carry it back to the generations that are depending upon them. All that said, they are very seldom actually looked at in terms of the critical sciences and that outcomes. Probiotics on women are going to be different than probiotics on men. It's just going to be the case. So I think that we have overlooked the most obvious component of our market. And if we have to make change based on high motivators, then I think a revenue piece of that is an easy one to document, because obviously the more success these people have when they go into the marketplace and buy product, the more likely they are to come back. And if we continue to just generate generic products for a population of Americans, much less looking at men versus women or people of color, and all the dynamics that go through with all of those economic and societal and cultural values that we just continue to overlook, we will miss our opportunity to actually start to shape and change the world. As I said, if we had 50% of the businesses being run by women, then we would have 100% of success with the health of women, children, and men.
Excellent. And I know, Will, you had some thoughts on that as well, missing serving that primary consumer.
Yeah, I've seen some very interesting recent consumer data from the US domestic market in particular, and certainly it tilts towards the alpha female of the household, to Karen's point, essentially making the grocery, the pharmaceutical, the supplement, what we'll call the cosmetics, they're the ones essentially more often than not making the decision for the household, which also forms future purchases for their children. They also make the purchasing decisions for the extended family, the family pet or pets. They're usually often overseeing that the majority of the time. Obviously, there are exceptions to that. And they're also the ones providing recommendations to their parents or their surviving parent or whatever it happens to be, and sometimes even extended family beyond that. And that's always the big disconnect that has struck me, is that the data is predominantly focused on men, yet this is such an important, maybe the most important for Gen X, Gen Z, and millennials. The female target market is incredibly important. And to me, it's the most underserved based upon the decision-making and consumer power that group otherwise have, or those groups otherwise have.
Yeah, I know. Sue, you were talking too about those generational issues, kind of talking about Gen X being that sandwich generation. Do you have any points to add?
Yeah, I think speaking of underserved and underrecognized, Gen X often gets left out, and right now, at least, they're the the peak earners. They're at the age where the earning is great, and there's some great marketing research surrounding that, and looking at especially during the pandemic, Gen X is known as the first latchkey generation, independent. They did well both financially, and from data looking at psychology during the COVID-19 overall. Of course, there's always exceptions. So those are some interesting things to read, and to read why people thought that that was the case and why you could use that as a marketing thing. And what was suggested was that they're a generation that's hard to convince. They're kind of skeptical. If anybody remembers like the Reality Bites and some of those old 80s movies, they're kind of skeptical, hard to convince. But once you convince them, they're super loyal and they'll stay with the brand. And to me, that's huge. So to know that they have the spending power, to know that they're making a lot of decisions for generations on either side because they may be the primary breadwinners, and they're very loyal to the products. If they work, they're hard to convince. So it goes back to what Will was talking about is, it's an opportunity to have more efficacy, and people are going to buy more and come back to buy if things work. Yeah.
That actually reminds me what Karen and Sue, what you said about the efficacy. Like when I was in consumer magazines, we made a very, very specific point where we talked a lot about natural products, supplements, and we made sure that we were talking about the exact dose. Like we tried to be much more careful than some consumer magazines may be. This is the dose, this is the brand that was used in the study, because we wanted people to get the results that they were after. But we weren't really thinking about who exactly was this study on. So even trying to do that due diligence, if the research isn't there, like you said, Karen, you may not be getting the results that you could be getting.
You may not be getting the results. And think about why people come to our industry. If you're looking at the millennials, the marketing around some of those brands from our newer entrepreneurs is really target on. I mean, they understand that young families are dealing with increased stress, issues of mental health, increased asthma rates. They're looking for environmental solutions, more natural solutions, and they're very actively looking for that. And we're there to set the stage for that. In contrast, you look at, my generation, the boomers, they're being they continue to be failed by the conventional medical system. And now there's a lot of conversation in the general media about medical gaslighting. So women go in and they have symptoms that are related potentially to an autoimmune disease, menopause, hair loss, lack of sleep. And these things by the conventional medical world typically are continually dismissed. So now they're going to go look for a different solution. And they've got a plethora of crap to choose from. Everything from things that really work well to things that will never work. And so they're patient, they have money, they can continue to try. But the reality is our commitment to that consumer, which is, as Will appropriately defined, is predominantly female, has to be shored up by sound research, because people are smarter consumers than they ever have been.
Absolutely. That's an excellent point. I want to just raise another comment that came up, which ties into something that we were talking about just a few ago, but fatty liver disease is very common among men and women. Even among women, different cultural habits play a key role in doing clinical trials with a specific supplement. And, as was noted, this can really change the outcome of the trials. So yes, thank you for sharing that. That's a good point. And another point that just came in on marketing. Marketing plays a key role to enroll women along with specific application of supplements. Rarely does a household woman hear about clinical trials. Our primary doctors are not well educated on supplements and also do not promote except for very few. So yeah, going back to some of the points that you were making, Karen, absolutely true on both of those. So please do keep your comments and questions coming in. Sue, did you want to add a point to that?
Yeah, I wanted to say another thing, an issue that I came across when I was preparing for today, and I think Trisha can probably comment on this from a academic research kind of perspective, is one thing I found that was very interesting was it was indicated that research was more likely to be done in women, whether it was purely for academic purposes or for market, if there was at least one woman on the author team. And typically speaking, that would be somebody, like if you looked at the order of authorship, if that was a woman that was listed towards the end of the authorship. So in other words, somebody who played a key role in study design. because what you bring up alludes study design. So if there's a call to market to women, it'll in our industry, it'll ultimately lead to study design. And then from a science and academic industry, having more women in science and in leading roles in science will also then lead to more research on women. So I don't know, Trisha wants to comment on that.
Yeah, I'll jump in. I actually, I did a quick calculation in preparation for this as well, just specific to the sports nutrition industry, highlighting exactly what Sue said, that historically, if the research is done on women, published on females, that there is there is a female lead author typically associated with that. And that of the female lead researchers, there's only about 20% of all the researchers contributing, historically and consistently to the sports nutrition industry. Only 20% of them are female. And that was just a US calculation based off of schools that I knew that are contributing a lot, especially to the Journal of Sports Nutrition and some other top tier journals, but it's very, very low.
Yeah, and another low stat that I found when I was researching this, just looking a little bit broader, only 32.5% of full-time tenured or tenure-track faculty members within higher academic ranks are women, and that's from the American Association of University Professors from December 2020. So it's pretty recent, and that's pretty low.
Yeah.
I think the other thing to look at too is promotion. So in academia, you have tenure and promotion. Typically, you get your first promotion when you get tenured, and then you go from there. And if you look at that, the stats are even less in there. You will more often see, it's rare to get a disconnect where you will get tenured but not promotion. But if you see who's getting that disconnect, it's predominantly women and not men. And that's just something that's just not being talked about and addressed. And the reason why that's relevant to this conversation is what I said before, is that it directly connects to then who the research is being done on. And I think there was some recognition surrounding this issue that prompted a lot of the work that's been done with the STEM programs and trying to encourage young women, even as early as elementary school, to enhance interest in science, technology, engineering, mathematics. And that's been slow to get funding and slow to get recognition, but at least it's there and it's growing. So that's very encouraging.
I agree. I see. Sorry, Maggie. I think Sue makes such an excellent point here that there are very few female faculty, and you don't have young females seeing women in those leadership roles. So it's this vicious cycle of they see it as an option, perhaps, and it's something we really need to tackle and address.
Yeah, absolutely. And then I was going to ask you, Karen, I mean, I know you're really working on this front, but if you look at racial diversity too, that's a whole nother layer.
Completely different layer.
Yeah. And I know you've got, you're working with getting scholarships. If you just want to talk about that just briefly, because I think that leads into the whole bringing people into the conversation to begin with.
Yeah, and when you talk about action items and being able to do something that's kind of productive and changing in the workforce, so what we have decided to do is support the development of historical Black colleges and university scholarships with a group called the Williams Franklin Foundation. So we have a fund that's called the Organic and Natural Health Fund, generally described to catch all of the food, beverage, and supplement world, and are raising funds to be able to give scholarships to these students who 90% of all Black physicians in the country are graduates of HBCUs. So we're talking about some really significant talent, right? So I had the opportunity to be on with some of the scholarship attendees and talk about the industry and the opportunities in the industry. Well, lo and behold, I was sitting opposite a woman who had created an entire internship program with the Dana-Farber Cancer Institute, fully paid, living expenses and a stipend, so that these young women in the sciences who were on the call, all young women, were literally looking at scientific careers and moving towards cancer research in Dana-Farber. And I had nothing in our quiver of goods to be able to say, yes, we can do the same thing. I mean, we haven't done the work that the conventional world has done in terms of creating opportunities to teach people what the industry is, the science base behind that, and to bring in that kind of expertise. That's one of the reasons that we have so few women that are doing this work in our industry, and certainly a big reason why we have very few people of color that we can, bring in. It's a shortage for sure.
Shortage, but you're working to raise awareness, and it's important work. So thank you for sharing that. I also wanted to ask you, I mean, Karen, I've been in the audience at a few panels with top industry leaders where you were the only woman on the stage. And not to take away from all the men doing excellent work being done, of course, but I do want to get a sense, as you just started to allude on, how do you rate our industry in terms of women getting that spot on the stage and getting these senior positions? Where are we? How far do we need to push to get better?
I point to this as a model of outnumbering men at the table today, and so I do think it's changing, and I am grateful for that. But I believe that it is women who are making that change. If you were at Expo West, by far the women outnumbered the men. And the stage was not reflective of that all the time, but I was fortunate enough to be in several sessions where it was all women. And I think that's slowly changing, but that's just one part of it. I mean, if you look at statistics in terms of what women, the positions women hold at senior levels across the country, I mean, yes, we're 47% of the workforce, slightly less than 41% of management, but we're only like 6% CEOs and 30% board members. It pretty much mirrors that in the pharmaceutical world. And for some reason, we don't have that data readily available in our own industry. At least I don't have it. So I think that the economic impact of that on the industry is not only just for what we're missing out in the marketplace in terms of revenue, but the economic impact of women in the industry is so significant. They estimate for the income disparity in pharma to be $532 million a year. So economically, again, I continue to look towards an economic response to make legitimate cause for it's just not fair, which of course it is not fair, but it's actually a missed business opportunity. And I think that's where, people are starting to listen, things are starting to change. But yes, we are still very much in a minority, even all the way down to the nonprofit world.
And as you were saying, it's actually, I had looked this stat up. Female CEOs represent just 8.1% of the top 500 companies on the Fortune 500 list. That's from June 2021. And that is an increase from the year before. So each year, or each recent year, it's been slowly ticking up, slowly. But also from Harvard Business Journal, recently highlighted research showing that firms with more women in senior positions are more profitable, more socially responsible, and provide safer, higher quality customer experiences. So there you go. So Trisha, I wanted to ask you, from your view, what is the state in the sports nutrition specifically for women? I know there was some talk about, there's so many RDs who are women, but in the leadership roles, what's it like specifically over there?
It's a little hard knocks. No, it definitely has maintained its dominance in men. We are obviously very aware that females are underrepresented, and we've got initiatives and tasks that we're working on. Specifically at our upcoming conference, I'm the first female president, and I want a women's seminar. So we're going to have a women's seminar, and I'm hoping that the next president will continue to carry that on. It will be carried out by a senior researcher in the field, Abby Smith-Ryan of the University of North Carolina, and then a new researcher, Katie Hirsch, who just recently took a tenure track position. But the purpose of it is going to be, this will be our first one, but to talk about how to actually study females. And I'm hoping that it will empower females in the room as well as males to take on more research in the female population. And then also Sue's very aware of this as she worked on it. We are working on a female position stand, and Sue played a major role in this. Our position stands are read by thousands of people. It has the most up-to-date research. This will be our first female physiology position stand, and I'm hoping that will draw more attention. That the ISSN, we want more female involvement, speakers, volunteers, leadership positions. We want them in those roles.
Excellent. I wanted to ask you, Sue, like, you made some good comments on this when we were talking earlier. Why does it matter? Why do we need women to be better represented in these leadership roles and in the research roles, academic?
Well, I think we've highlighted it. I'll start with what Karen said, where first of all, it's just fair. That there shouldn't be any more barriers than there are for men. I mean, you know, there are barriers to getting a PhD and to getting an advanced leadership and CEO, et cetera. The barriers should be equal. It is the point. We're we're not asking for special favors, and I think that because especially if you go back to looking at it from, because we've been talking about it from so many different perspectives, an academic, but when it comes down to it in our industry, when you look at it from a marketing, sales, and money perspective, it makes sense on so many levels. And we see some companies that are using the opportunity and are women-specific companies, right? Where they're looking at supplements and products specific to women. They hire women to market, they hire women to do the research, to do the senior position. It's smart. It's just makes sense on so many levels, right? There's fair and makes sense. I'm using very non-scientific words, but we don't have to get scientific to answer your question. And I think because if we know, and I'm not a marketing major, but it just seems to make sense. If we know that these are the people buying the products and spending the money, we're in an industry where ultimately we're a for-profit industry. It just makes sense. And then we have data that shows that when women are doing the research, they're more likely to be sensitive to including women, or to at least translating it to women, because not everything that it has to be. It just needs to be maybe looked through the lens of a female specific client. And then we have women doing the science that substantiates it. They're going to look at it differently. So it just makes total sense from all across, and women marketers, women in media to communicate it like yourself. Yeah.
Excellent. Will, I wanted to ask you, I want to say thank you to Nutrasource for just spearheading this discussion and sponsoring this, because shining a light, as Sue was just saying, shining a light on the issues, raising awareness, and exploring what role we can all play is just an essential start. So, Will, one of the things that I find so impressive about Nutrasource is that there's so much collaboration. So we've had a few calls leading up to this, and you're the CEO, but from what I've witnessed, in this series and in other projects that we've collaborated on, the meetings always include multiple voices. They're very collaborative. Different perspectives are heard and appreciated. So for men out there in leadership roles who want to be part of creating a more equitable industry, like, what is your advice? What are your leadership philosophies to help get people coming around?
Yeah, well, there's a lot to answer there, but I'll try and keep it brief. At Nutrasource right now, I just looked at this the other day for International Women's Day and Month. Right now, we're approximately just over 70% female staff. And that wasn't intentional or unintentional per se, because we do run a meritocracy. We try and hire the best people for the best roles that make sense. But it's interesting to me that there's a lot of discussion around diversity for diversity's sake, around gender, race, other categories, versus diversity of opinion. And those are in two separate worlds, but for me, they're one and the same. So here we have a number of different cultures as well in our staff complement. And when you have a nice balance and mix of gender, backgrounds, ages too, because ageism and youthism is a whole thing as well. When you have a really nice, healthy mix of all that, you get that diversity of opinion. And I have found that to allow and encourage that has been very, very helpful for our company culture and for the company's growth. And I think the other thing is for entrepreneurs and for CEOs, for me, you're and Karen and I have talked about this previously, you're so busy as an entrepreneur running your business, or as a CEO running your business, you're not thinking about everyone's sensitivities. It's not because you don't care. It's because your mind's in business zone and how do I move the chess pieces up the board today for my organization? So it's really important to be open to feedback, but also that people have to feel safe regardless of who they are within your business culture. I call it a business ecosystem. That's what it is to me, to be bold and aggressive and bring the stuff forward. And not that I'm necessarily a big fan of his, but one quote from Steve Jobs that I really liked was, you don't hire people to tell them what to do, you hire people who can tell you what to do. And to me, that is a really important view of how at least we like to manage here, and put your people forward and hire good people. And I think a woman's perspective, and these are very general statements, of course, with a lot of caveats, but a woman's perspective is a unique perspective to a man's perspective. Most of the time, not always, but most of the time. And it's a very healthy perspective, and it causes pause for thought. And as a quote unquote leader, it pauses you to think about things in a unique and different way, as do different cultures, different ethnicities, different age brackets. So we have a really healthy mix of that.
Excellent. We have a question that came in for you too. It's a two-part question. I think you pretty much answered the first part of it, but I'll ask you the second part. Is there anything we as women should be doing or saying differently to get more men to support, because we can't just have women spreading this message? So how do we get more men to do what you did?
Well, from a guy's perspective, I'm happy to answer that, but I think be more bold and more aggressive. Your voice may not be, it's a two-way street, right? Any relationship, any good communication is a two-way street. And if as a male CEO leader, you're not speaking to me about what your concerns are, your issues are, what I like to do with all staff is say, you can bring me and critique anything you want. You can bring me any problem you want, but you also need to bring the solution. And then you have to be responsible for executing and implementing the solution and be accountable to it. And I'll support you, but you have to own your critique by also presenting the solution. And I also think that I have found, again, these are very general statements, so I don't want to get caught in this specifically, but that women are generally more agreeable. And you should be more aggressive, diplomatically, but more aggressive and more bold. So when it comes time for the performance review and they ask for the raise, or it comes time for, hey, I want a new title that better reflects how I'm working now because you've added the 4 previous people that left responsibilities to my role. I want a new title that reflects what I'm doing now. I'd say be more bold and aggressive in a constructive, pick the window. If your male supervisor's having an off day or off week, maybe that's not the right time. So be smart about the timing, but just generally be more bold and aggressive, more assertive with support.
I would add to that, yeah, I totally agree with you. I mean, I would add that, one of the strongest suits that women have is the ability for empathy. And the Harvard Business Review has documented this, that over and over and over, women score statistically significantly higher on leadership skills. So those seem like soft skills too often to us. And the reason they seem soft is because we don't use our voice behind that. So I had the privilege of interviewing 7 CEOs recently. And one of the responses was, ask for what you want. Men do it all the time. It doesn't have to be, done in an adverse or confrontational way at all, but ask for what you want. And use those skills that you have, those leadership qualities, to bring your team together so that you can begin to ask for those leadership opportunities more often. Like, get savvy about your talents. It's really, I think it's really important. And don't go, and in your listening skills, which are one of your strongest suits, turn those into action items. So don't just listen for the sake of listening, but create a pattern of behavior that associates your strengths with that outcome. And then, of course, reward people, accordingly to that. The other thing that I think women don't do well, and for lots of reasons, is find mentors inside the organization or outside the organization. This was a theme that came up over and over in these interviews that I did was, did I have mentors? Did I not? Most of these women were extremely entrepreneurial. They did it themselves. They may have had mentors, they may not, but they did it themselves. We can't always afford to have women carry that burden. they should be able to climb the corporate ladder just as quickly as any guy, right? So I think those are some of the takeaways that I've had from those interviews and just from my own experience. It doesn't pay to be baby, sit in the corner and be nice all the time, and be smart about how you use your voice.
I think I want to chime in because listening to both of you, I think it's very interesting how you said the same thing in different ways.
Exactly.
So I think an important part is also understanding that men and women do communicate differently, and that both of us have to be sensitive to the ways in which the other communicates. And this goes across, like this then goes across genders and cultures and that sort of thing. And also be sensitive to, you know, like when you are communicating, differences in body language, pausing. You know, women tend to, in a room full of men who are all trying to get a word in, it's just sometimes a tendency to sit, wait, let it, you know, filter out. And we shouldn't be taught that's a bad thing. Like women do this and it's bad, because a lot of the world has been created from male dynamics and male approaches. And so I think the approach should be that we learn to work together from each other's perspective. And that perspective includes gender. It's not just exclusive to gender, but it includes it. And that to me is what Nutrasource has created. It's created an environment whereby we can do that. And we do. I mean, you know, we have different cultures. We work in different countries. They're freezing and I'm not. And, you know, and so we all work, but we all collaborate really well together because will and leadership have created this environment whereby we can do that. So I think that's what we both said is absolutely critical.
Excellent, thank you. Trisha, do you want to add your advice in terms of advice for women trying to advance their work and get their messages out and get their work out?
Yeah, I mean, I have the same message, a support system that you can lean on, mentors that can provide you with feedback, and someone you trust to talk with, especially when you're making those kind of bigger decisions to go in and talk to your boss about a raise, and getting feedback from multiple people and multiple views, I think is really, really powerful and can help build confidence in young women. So I agree with what Will, Sue, and Karen all said.
Excellent, thank you. So we do have a little over 5 more minutes. If anybody has any more questions, please do present them because we have some time to get to your questions. But I want to use some of the time that we have left to just ask about initiatives. I know, Karen, you have something in the works called Women in Nutraceuticals. Can you tell us about that and what you're planning? And I understand that's going to be looking at this research equation as well.
It is. I mean, it was formed in just last year. And so the board was just selected when we were all in Anaheim. It's basically a group that, different than some of the other groups you've seen like this before, designed to empower women in nutraceuticals to unlock their personal and professional potential. And so the first 3 years goals really are founded around, you know, how to ensure professional and personal success, to find equity for women-owned ventures, and also to realize the economic aspects and professional aspects of that equity, and then to increase leadership roles, including leadership roles in research. So I think that it's very exciting. We're looking forward to the work. We have a dynamic group of mostly women and some men. So that's a really heartening thing about it. And I want to just add that, you know, I think we all should be careful to not make assumptions as we walk into this conversation, because I can remember distinctly when I went to my board and said, I can't lift my head and walk around in the industry anymore. There are no women on this board. And they went, let's put 3 on. And I said, yes. So I leave that as my final comment on it, to say, yes, this is work we all have to do. And I think there's just things that are so obvious and so easy to fix that we just need to have that continual conversation. I applaud you guys for having this forum.
Well, thank you for joining us. We do have another question that came in. This one's for you, Sue. You've had a lot of success getting your studies published. Any advice for those trying to get their work out there?
Well, thank you for that. And yeah, it goes back to what collaboration. And I've worked with a lot of different people in the industry. I've rarely written a paper by myself because it's so important to get everybody's different perspectives. Yeah, men and women across the board. So I think that's my number one word. And I think Trisha may have some feedback on that question too, because she's done a lot of work.
No, I agree. Collaboration. It's all about working together and having a network of experts in different areas and setting timelines also. Having deadlines, having somebody hold you accountable, that always helps too.
That's what, and you know, it speaks to what makes the ISSM position stands. They're referenced and they're highly regarded. And if you look, there's like a slew of authors on there, and really everybody is reviewing and writing and working. And we break it up into sections. Somebody's responsible for integrating, then it gets reviewed, and that really is how you get published, how you put out good stuff, and networking, making good relationships. And a lot of the people that I published with, I've known since graduate school. And I maintain those relationships. Some of them are mentors, some of them I mentored, going back to what we said before. So connections, collaboration, I think.
Excellent. Yeah. And a comment that came in, women should not be intimidated by the men they are dealing with. So yeah, absolutely. Absolutely. Will, any final thoughts you want to leave us with before we wrap up?
I'd say thanks again, Maggie, for pulling this all together. It's a very intriguing and interesting topic, and for the brands and branded ingredient companies on the line today, I would just encourage you to look at your portfolio and get a better understanding and a deeper dive as to how it is positioned to those consumer groups as well. As part of the discussion today was also business, and on the business side, there's some real opportunities here, and there's some key female target markets that are not being reached out to, are not being engaged in the kind of manner they otherwise could be. It's nowhere near optimal, and there's some real opportunity there.
And that segues perfectly into, that's really going to be the next part of our discussion. We're really going to look at the positioning of products, the marketing and the messaging. We're going to have more experts joining us with expertise in those areas. And so stay tuned to WholeFoodsMagazine.com. We'll share with you when we'll be doing that talk. And to everybody who joined us, thank you so much. Again, it was my honor. Thank you to Nutrasource and to all of our speakers. I've certainly learned a lot, and I feel inspired, and I know we've got a lot of work to do, but we're ready to go dig in and do it. So thank you all.